Good morning, everybody. I'm Lucica Ditiu. I'm the Executive Secretary of the Stop TB Partnership. I would like to start by apologizing for not being able to make the trip and to be there with you. I want to thank the organizers for giving me the opportunity to send this recorded message. I would like to start by thanking our colleagues from Médecins Sans Frontières office in Myanmar. I would like to thank Becky for all the efforts that she did to have you all there and everything to go and run so smooth. I would like to thank our colleagues from the WHO country office. And most and foremost, I would like to thank the Minister of Health, the TB program, and all of you for taking the time to be today in this room and to discuss so important things related to drug-resistant TB, TB HIV, TB in children, and overall TB challenges in Myanmar and how to overcome them. Time is Now is the title of the seminar that you are part of today. And I think we all know very well why time is now. TB is a disease that is with us for thousands of years. And unfortunately, we didn't succeed to eliminate it. We hear these days conversations around eliminating malaria, eliminating HIV/AIDS. And I think it's very important that we have a conversation on what we can do together to advance in the fight against tuberculosis. We have big challenges in front of us, even though we know this disease. We know how it is transmitted. We know the bug. We know how to treat it. We still have big challenges in front of us. There are 2 billion people that are infected with TB. There are 9 million people that are getting sick with TB every year. And unfortunately, at global level, we are unable to detect more than 6 million of them. Therefore, we have 3 million of people every year at global level that are somewhere out there, undetected, untreated, probably quietly dying, but worse than that, infecting each of them other 10, and therefore contributing to the overall pool of infected TB cases. MDR-TB, none of you need me to say that. It's a huge burden that we have to overcome. We estimate that we have around 630,000 MDR-TB cases every year. Out of it, around 60,000 were in 2011 enrolled on diagnosis and treatment. And therefore, this leaves a huge gap for us to catch up. Time is now, you say. Why now, will somebody ask us? I think we learned a lot, and I think each of one in the room knows a lot about the TB epidemic and about how the disease in the country is affecting different groups and different regions. We learn the number of cases. We learn painfully sometimes, like in Myanmar, that the prevalence can go up, that the numbers of MDR-TB cases is pretty high. We learned that we have hotspots, that we have places in which if we can focus much more, we might obtain better results than if we are just doing things trying to cover the entire country. So we learned about the epidemic. We also learned what to do in different parts of the world. We learned that if we are focusing our interventions and we try to be imaginative, to think out of the box, to try and find every single TB patient and to put the right diagnosis and to put the right treatment, we can achieve much more. We learned that by simply integrating TB and HIV interventions, we saved 1.5 million lives in 5 years. We learned that if we are involving the communities and if we go at the lowest, at the ground level, we are able to increase the cases detected 2 times. We learned through some of the projects that we funded in the Stop TB Partnership through TB Reach, that if we focus and prioritize and we try to focus, for example, in being more active in finding the cases, focusing on those that are most vulnerable, those that are having the biggest difficulties in accessing the services, we have concrete examples in which the detection of cases increased up to 20 times. Why now? Why is time now? Is because we have new tools. We are all very excited having the gene expert, having the chance to know that it's a TB disease, more than that, resistant to rifampin in 90 minutes. We are excited because new drugs and new regimens are coming. We are excited because it is possible. So we have now the tools. So time is now for action, and time is now to be bold. That's why I think it's also, what I would like to say is that it's extremely important to have not only the boldness, but also to dare to ask for more. And what will be to ask for more, especially in Myanmar, is in speaking about universal access for all patients with TB, with drug-resistant TB, with TB-HIV, for diagnosis, for treatment and care, for all of them. It's not easy to speak about this. And that's why I really appreciate the government efforts and the Minister of Health and the team of the NTP for having conversation around this. Because obviously there are challenges in trying to address and when you start speaking about universal access for all, there are challenges in the systems, there are challenges in the funding. However, it is possible to start and discuss about it. It is possible to change the thinking, and it is possible to have the policies to address that. Obviously, it will need some shifting into conversations. It will need to look over decentralization and patient-centered approaches. It will definitively request a focus on the vulnerable groups. We in TB need to speak much more about the vulnerable groups, the prisoners, migrants, drug users. These are the ones that are the most difficult to find. Additional efforts and therefore additional financing resources are needed if we really want to find all these people, because it's not that easy. It's not only to find, but it's also to ensure that these people belonging to these vulnerable groups have access to services and are not only diagnosed, but also continue the treatment and are kept under treatment and care. Speaking of all of this, it's easy, but obviously it will be needed financial support. Myanmar is benefiting from an increased attention of certain donors, and Global Fund is a big supporter of the Myanmar Minister of Health, of the Myanmar health system. However, in order to address and to speak about universal care, the funding from the Global Fund will not be enough. But what I think it will be very important is if you all together, over these discussions that you will have, you start thinking about what means universal care, what will mean to speak about decentralized, what will mean to focus on high groups, what will request in terms of financial resources. And even though the domestic right now and whatever is available from the donors will not be enough to cover all these ambitious plans, the existence of these ambitious plans will trigger for sure additional funding for all of you. The last point I want to make, and I think your meeting today is actually a very good example of what I would like to say. It's working in partnership. There is not a single structure, institution, and individual that will be able to deliver to ensure that all TB patients are properly diagnosed, are properly treated, and are finally and ultimately we will have no one dying of TB. The government can do as much that can do. Reaching out to some vulnerable groups might request involvement of NGOs. Civil society and those that are affected by tuberculosis should be at the core of the interventions and should be around the table as well. Donors will have a part in this conversation. But the meeting today is a very good example of putting everybody together to move towards some ambitious plans and targets. I think we should all be aware that without having the right tools and without having the right plans for scale up, we will not advance that much. I think we are all aware that without very good research, we will not have the right tools. We still need the right combination of treatment. We still need a point of care for diagnosis, and we still need a vaccine. But we need to aim for this. We need each one of us to make the right efforts. And Myanmar in terms of research can do a lot in terms of operational research, can contribute as well in looking at the short regimens, how do they function, and engage into more of the clinical work. There are ways in getting engaged and support this global movement against TB. Time is now. I challenge you all and us all in Geneva to be part of the generation that is pushing TB out of the door and is changing the tide in drug-resistant TB and TB-HIV. Thank you very much.